Welcome to Cohen in the City, the Suburban On Air, and my guest today from the MUHC, Dr. Peter Lakatos, who is with the also the McGill IBD Research Group, inflammatory bowel disease, and he'll be giving a Zoom lecture on Wednesday, September 23rd at 7 p.m. Via Zoom. Welcome, Dr. Lakatos.
Thank you very much for the invitation, Mike. Nice to meet you.
Great to have you with us. Heard some great things about you. I know you've been associated with McGill since 2005. You've been living here permanently since 2017. You're very, very well thought of already in the IBD community. For someone watching this video right now who may have a friend or a relative who has IBD, I always like asking, can you just explain simply what is IBD?
So, Mike, thank you for the question. So IBD, I think, is now very well known even in the general population. That means that somebody has trouble with the intestine. And unfortunately, the two forms of the disease, Crohn's disease and colitis, come with a lot of issues. That means that they have cramps, they have urgency, they have diarrhea, they might have some bloody stools, they lose weight, very fatigued. So basically it affects, all aspects of the life. And our real goal is to get them as normal as possible to really continue their, daily quality of life and career.
Dr. Lakatos, the legendary Dr. Ernest Seidman passed away last year. I still find it hard to believe he's no longer with us. He was a remarkable man who I know you got to know because you affiliated with McGill, like you said, going back to 2005. I know that you and Dr. Biton and others are trying to fill his void, but how much of a loss has it been not having Dr. Seidman around?
So actually, I have known Dr. Seidman since, as you said, the early 2000s, and he has been a great person and a great researcher as well as clinician. And he had the advantage of, showing both angles of that picture, pediatric as well as the adult side. His primary interest was in research, understanding how the disease is developing and to get the new therapies and the optimization of the new therapies, for the kids as well as adults. And with regards to the basic side of the research, he was looking into, the development on animal models as well as, some, small biopsy samples and surgical samples. So it was quite broad spectrum. And what you have heard, it's completely true. So he was very well known, not only in Canada, but worldwide. We miss him.
You miss him. We all miss him. I miss him. The McGill IBD Research Group does fantastic work, raises some very important funds to give you the extra resources you need. So I know you're very involved right now, kind of stepped in to help with Dr. Seidman's untimely passing.
Exactly. So we have a very difficult task now to actually try to, fill his shoes. Of course, it's difficult, but we try our best. So Dr. Biton is the division head as well as one of the important IBD clinicians. And I was recruited as the head of the IBD center. So now our goal is really to get the McGill group back to the stage, very much the same visibility with some new faces. Also including, the Canadian-wide and international research spectrum. I dare say that this is, of course, partly why we not only try to reach out, to our colleagues and, get collaborations on research, but also this year, and partly because of the COVID, we wanted to strengthen, ties with the patient, group. And this is why kindly we offer this type of, lectures that are more for both patients as well as some clinicians.
I'm looking forward to seeing your lecture on Zoom. They've done a few already. It's the new normal. We'll include details on how people can register in the body of this video in the description section. But can you give us a little bit of a sneak peek on some of the topics you'll be addressing when you do this lecture next week?
Yeah. So earlier this year, we were trying to cover, of course, the psychosocial aspect, partly the COVID, epidemic and how it affects, especially, patients with chronic diseases. And this lecture actually builds on that route. And then now we try to cover a little bit the patient expectations from the care and from information that they can receive from their treating physicians, from internet, from different sources. So I actually gathered all the information that was published around, this topic, and tried to structure it as what patients usually expect, what is the expectation, what physicians should know, and what patients should actually be able to ask to their physicians about, the disease, the prognosis at the start when they have the diagnosis fresh, what they should be able to discuss and how they should be involved in the decision making during the follow-up when they have a flare, when they have a problem, and also to discuss long-term outcomes, long-term maybe anxieties as fears, like, the feared complications. The most feared, of course, are cancer, that would be colorectal cancer, or to some patients, even liver cancer, depending on whether they have, a biliary tract, so a liver involvement. And these are basically the core topics. But how I want to structure the lecture is that I give up, these little pillars, and then at every point we can stop and dive in a little bit more deep whenever there is some question or discussion.
And I know it works. I've been previous lectures by the McGill IBD Research Group on Zoom already, and it's very well structured and very easy through the chat mechanism to ask questions. I find that I've been to go into those lectures for years, and the attendance is almost double or triple by Zoom because it's so easy. You finish your supper and you just go into your room and turn your computer on. So it really is the new normal. Tell me, COVID-19, how has that impacted people with Crohn's disease and colitis? Are they more at risk to getting COVID and getting serious complications?
So I think, we just had a lecture in June, and that is actually available on the website of it. So if somebody would like to look at in-depth, that is, downloadable, and, you can check. However, in the nutshell, we have a good news now because we have had, followed up, the international publications about, COVID and IBD. And what is known, the good news, that in general, IBD patients who are well controlled, who don't need high dose of prednisone, who are not elderly or don't have comorbidities, and at this point, the older age, I wouldn't say even elderly, would start around 65 to 70. So these are the patients who are not at higher risk than the general population. And of course, those patients who are more, in the very severe active disease side, needing prednisone at a high dose, or are elderly with comorbidities like diabetes or respiratory diseases, for them, we have to watch out and would like to really avoid that they have contact and the possibility to catch this, complication or disease.
People who need colonoscopies, is that something that because of COVID, people have been afraid to come to the hospital and maybe they're not having them at the time they should? What would you recommend they do?
So first of all, I think, there were a lot of anxieties and unknowns, to the beginning of the COVID, epidemic. Of course, that was also affecting us. We didn't know, what to expect with regards to outcome. We've seen the alerting, picture from, Asia and Europe, and then it came to Canada. So to be honest, in March and April, it was very difficult to access other than emergency care. And this is where I was very proud that we developed last year, actually, what we call a rapid access clinic, meaning that at 24/7, we would accept email or calls, mainly emails. And the nurses, most of the time with one of the clinicians, that is usually me, would triage, these requests, and would come back within 1 or 2 business days. And we tracked, and I dare say we could keep our promise despite the COVID. So, and you can, of course, think about that. That was about triple or quadruple email number per day because of anxiety and, of course, trouble with the patients. Now, thereafter, when we have seen the first publications in IBD and COVID, and of course, we relaxed a little bit, the usual routine to come to the hospital. Now we want to convince our patients to actually attend either telemedicine follow-up at least, with some, limited follow-up with regards to blood tests and stool tests. And if they really need endoscopy, now we are back to about 75 to 80% of the usual practice, meaning there's no problem. And we really do all the precautions, meaning that, all the rooms are isolated. We use masks. After every procedure, there is more standard, disinfection for the rooms. Even before that, that was the norm, but now it's a little bit more, stringent, I would say. And of course, the same is applying to the patient with isolation and social distancing in the hospital. So now I would say the hospitals are really safe. Not only McGill, they have the same standards across Quebec, but I think now the access, at least to telemedicine and endoscopy, is quite good. And if you need a face-to-face visit, then we are about 25-30% back in the clinics as well. So yes, for instance, yesterday I have seen about a dozen of patients who needed face-to-face follow-up because of flare, and we were able to provide that already. So that's good.
Okay, so a lot of good news. I look forward to your lecture on the 23rd of September. I will include the link for people to register. There's no charge, of course. And the McGill IBD Research Group will be having its gala virtually this year with Oz Perlman. He's going to read Dr. Lakatos's mind on November the 12th. So get ready, Dr. Lakatos. It's supposed to be, he's an amazing guy. I saw him live 2 years ago for the McGill IBD Research Group. And he's going to do this all on Zoom and blow people away. So information at mcgillibd.ca. So thank you for your time. Good luck, and we'll look forward to the lecture.
I thank you very much for the invitation and for the interview. Have a nice day. Thank you.
My pleasure.